Welcome to Music Therapy Online. I'm Dr. Anita Swanson, and I'm here to talk to you about supervision in music therapy. I'm Associate Professor of Music Therapy, and I've been a music therapist for about 20 years. I worked first in private practice, mainly with children with autism, but many other developmental disabilities and intellectual disabilities as well. I've served nearly every clinical population out there. Later in life, I've been doing a lot of physical rehab work, working with people with strokes, aphasia, and traumatic brain injuries. I have all three of my degrees in music therapy. I come from Southwestern Oklahoma State University for my bachelor's. I'd never been to Oklahoma before, so I decided to give it a try. My master's degree I completed while I was working, and so that was at Texas Women's University in Denton, Texas. And then I went to the University of Kansas for my doctorate degree. During this time, I've been supervising in various capacities for over the last 15 years. So I've supervised students, interns, staff, and other clinical supervisors. I also serve the global music therapy community by being a member of the World Federation of Music Therapy Council. So, regarding supervision in music therapy, supervision is a critical part of training for students and interns, and it is needed for professional success. So today we'll cover supervision in general for students, interns, professionals, and employees. So if you're nervous or feel inadequate about being a supervisor, this tutorial is for you. Or if you just want to look at supervision in a different light, this tutorial is for you. In this tutorial, you'll have opportunities to reflect on yourself and your own practice. You will consider the supervisee-supervisor relationship, and you will be exposed to the structures and strategies for effective supervision. So our roadmap for today is to talk about what is supervision and what are the purposes of it. What makes an effective supervisor? We're going to look at the supervisee-supervisor relationship, what to do in supervision, and what to avoid in supervision. So why am I so passionate about this topic? After practicing for a while, I had decided to go back and do my doctorate, with one of the main purposes being I wanted to help create more effective music therapists because there's such a need for music therapists in our communities. So that was one of my parts, and a significant part of creating effective music therapists is supervision, both in school and in professional work. In our profession and in related professions, supervision is a necessary part of training. Yet it's something that usually people are not trained on how to do. Typically, there's no training in supervision. Thus, people just tend to do what they were taught themselves. However they were supervised, they tend to play out in their own supervision when it's their turn to supervise. This may or may not be beneficial. It could lead to the perpetuation of issues within the supervision relationship or process. As music therapists, we want to maintain a high standard of practice. Therefore, qualified supervision is needed throughout one's training and one's professional career. In order to have qualified supervision, we need qualified supervisors who have learned how to provide effective supervision.